Well, Netcare, Africa's third biggest private hospital group, posted a 12% rise in first half profit, helped by a strong performance in South Africa and favourable currency swings. Joining us now for more on the numbers, Richard Friedland, CEO of Netcare. Richard, good to have you with us on Power Lunch. Looking at the numbers, it's a tale of two countries, as one might say. You've got South Africa, which is doing well, and then the UK, of course, being hit by the recession, being hit by the fact that margins are under pressure there. Just take us through the past 6 months for Netcare.
Well, as you correctly said, we've had a very strong performance in South Africa with very good operating leverage and our margins widening across all of our divisions due to efficiencies and also increased capacity utilization. In the United Kingdom, it's a very credible performance against the backdrop of probably the worst recession in 60 years. They've shed 1 million jobs, 700,000 in the public sector, 300,000 in the private sector, and we've also, on the positive side, seen a lot of good growth from the NHS.
Looking at, let's focus in on South Africa first, because as I said, two different markets right now. You've got South Africa, where you had revenue growth in the single digits and managing to turn operating profit growth in double digits. 13% growth in South African business, 11.2% growth in operating profit for your hospital. So take us through the numbers there and where you're growing specifically.
So in South Africa, we grew patient days. We've also added on some beds. Our primary care division, which consists of about 88 primary care clinics, also grew. And we're also seeing improved margins coming through in our dialysis division. And also in our oncology division.
What are the plans for primary care? Because interesting, a growth in operating profit, 114% growth there. What are the plans for this still very small part of your business? Are you looking to leverage off that type of speciality and the core competencies you have in that space?
Yeah, absolutely. You know, it's come off a low base, and it made losses up till about 2009, and slowly we've turned around primary care, and it's now a solid platform. And if you look at the future delivery of healthcare in South Africa, primary care must be a key component. If you want to see a specialist in the UK or in Europe or in Australia, you need to go see your GP first, whether you're in the public sector or the private sector. Here we don't have that, and we think that primary care is the real gatekeeper to keeping costs at an appropriate level and an appropriate level of care.
You mentioned the fact that margins have improved in South Africa. How sustainable is that in light of the fact that there's a lot of cost pressure in South Africa across the board? Anyone who needs to turn on a light knows that electricity continues to go higher.
So I think globally, given where healthcare is, we're all going to have to be providing more services for less. And I think if you look at some of the slides we spoke to, there are a number of initiatives that we've introduced that will come to fruition over the next 18 months that should allow us, hopefully, to expand margins. And we elucidated upon them in the presentation. And a number of these should allow us to find more efficiencies in the business and be more innovative in certain of our service lines and hopefully widen the margin.
What does innovation mean to Netcare right now? Tell us about some of those plans in terms of innovation and staying relevant in a market where we do have quite a few players in the space.
Well, I think our most innovative model is actually in Lesotho, where we are taking full responsibility for an integrated model of healthcare. We're looking after state patients for 18 years. We run the primary care services, we run the tertiary care services, and we're absolutely responsible for the clinical outcomes. Now, that's a huge responsibility to take. It's a 1.2 billion rand investment, and we've basically put our money where our mouth is and said that actually we believe this is the pilot for future healthcare, not only in Africa. It's the largest public-private partnership in Africa, really.
So how does that extend to South Africa in light of the fact that we've got the NHI pilot projects on the go and, of course, moving towards state healthcare?
So in terms of NHI, we believe that it's absolutely critical to be supporting some form of NHI in order to bring about a more equitable form of healthcare delivery in our country. And we've been preparing ourselves for that. We've assessed all of our hospitals in terms of the core standards. We're about to do our primary care centres. We believe this is a sector first, but nonetheless, looking forward, we think that we want to participate in it. We've been participating in the UK. We're now the largest provider of NHS services to the NHS in the private hospital market in the UK.
So taking the learnings from the
Correct.
NHS system, of course, in the UK and seeing how that can apply to South Africa. So let's talk about the UK, because looking at the numbers there, revenue up was up by 2.5%, but EBITDA falling back 1.3%. You made £88.9 million in terms of that EBITDA number. It was a loss as a result of some tax implications as well. But tell us about what you're doing in light of the fact that the UK is still in a recession. You've got the number of medical insured lives coming under pressure. How do you position yourself right now to withstand the slowdown?
Well, Sam, there's been a structural change in the UK market which changes our outlook for the UK and makes us a lot more positive. Patient choice, which is the ability to choose a private provider as opposed to an NHS, has become entrenched in the UK market. So when we made this acquisition in 2006, only 2.5% of our volumes were from government patients. They're now 27.5%. And so we believe that the private sector will be able to play an increasingly important role in the rollout and provision of public health. PMI has come under pressure, but we are focusing on making ourselves extremely efficient so that when the market does eventually recover, there are strong demographic demands for healthcare. People are aging. There's new technologies, and we'll be able to take a benefit of that. So we remain very positive on the future of healthcare provision in the UK.
Any signs of light yet in the UK, or is it too early to call that, or any signs that we're going to be returning to growth in the private sector space?
I think there are two signs, but I would say one swallow doesn't make a spring. Firstly, job numbers in the UK to the end of February, for the 3-month period to the end of February, increased by 35,000. That's the first increase we've seen in more than a year. The second is that our self-pay market, in other words, where people are paying out of pocket, has increased by 7.9%. And that's the first increase we're seeing in 2 years. I think it's too early to call any form of recovery, but we're certainly positioning ourselves for that recovery in the long term.
In terms of your debt sitting at 25.68 billion rand right now, in the past 6 months, net finance expenses increased by 25 million rand to 973 million rand. In light of the fact that you've got a big chunk of debt sitting on your balance sheet right now, how well positioned are you to manage your debt and manage these finance charges?
Well, we're extremely well positioned, because if you look, one of the standout features in South Africa and the UK is our working capital management. And you'll see that we have record cash levels in the UK, some £123 million of cash balance at the end of the 6 months. And equally in South Africa, we've reduced our debt. The issue of the UK debt, and it's important to understand this, is that it's completely non-recourse to South Africa. And it's completely the entire UK debt. And it's ring-fenced, so we're not the underwriter of last resort to the property debt that's in the UK, and we are currently servicing it. Clearly, there's a negotiation to be had with the debt holders as this matures, and we're in that process.
So no implications for local shareholders?
Absolutely not. And
what prospect then, or what hope can you give for shareholders here in South Africa? Because the share price of Netcare hasn't gone anywhere for some time now. Where's the growth coming from?
I don't think the share prices aren't gone anywhere because of the growth. I think there is a concern in the market, and I think it's unfounded, that we're about to have a rights issue that's going to dilute shareholders in order to fund the refinancing of the property portfolio in the UK. And that is unfounded and has no basis in fact. What we're saying is we're entering those negotiations, but we're not going to do anything that's going to jeopardize either the South African business or Netcare Limited, or in fact the financial security of OPCO.